So we've all heard about the issues with implants and the retrievals, the post-market surveillance. Of interest, when we looked at the June 2012 FDA orthopedic device meeting, the recommendation for symptomatic patients is that MRI be utilized. However, your radiologist may go to you and say that only 4 of the total joint devices have been, quote unquote, approved as MR safe. To that end, my colleagues and I in our lab, Matt Koff, have actually evaluated the science and the physics behind the principles of putting an implant into a large magnetic field and have shown it to be safe. And I provide this reference to you if your radiologists are concerned so as to assuage some of their fears.
Over time, it's occurred to me that there's a lot more that we need to do for these patients. And with my background in molecular and cellular biology, I've been trying to think about how to use molecular approaches to this question. And that's what I want to talk about today.
I mean, maybe, Hollis, you do want to talk a little bit about the RO1.
Sure. So,
because I think Dr.
Yeah,
Vanderwall will see.
Absolutely. So we're fortunate enough to be funded for 3 years for an RO1, which has 2 specific aims. One is to look at patients who are going for a revision, and we are doing pre-revision MRI, and then taking targeted biopsies based on where we see abnormal signal or collection on the MR, and then being evaluated very comprehensively. Ed's group has access to these patients as well, so he can do his microRNA analysis at the same time that we're doing our histology.